For many Kentuckians, healthcare feels like a factory that whitewashes problems with pills and churns out one-size-fits-all solutions like surgery. I'm Dr. Donish, a native Kentuckian and the medical director of Wellward Regenerative Medicine. As a Johns Hopkins trained double board certified anesthesiologist and regenerative pain specialist, I believe it's time to revive the caring spirit of healthcare and offer you, the patient, the healing that you deserve. This 50 Shades of Pain show is one way we empower you to receive sustainable treatments for injury and pain without surgery, addictive medications, and without being the victim of the system designed to work against your healing. I encourage you to start your healing journey at wellwardmed.com. Today I'm with my co-host, Dr. James Escaloni. Dr. Escaloni serves as a physical therapist and a physician extender at Wellward. Like myself, he's seen firsthand patients who have suffered unnecessarily, not for lack of qualified or caring doctors, but rather from a broken healthcare system. So James, what are we talking about today?
Okay, we're going to be talking all about prolotherapy and what it can do for patients. So, for you guys at home, have you gone through some rehabilitation and it seemed that you were doing better and better and better, and then you're stuck, can't get over that edge? Have you felt that you've had some sort of pain that just seems to get better and better, but then it's kind of just on this one little spot, doesn't want to go away? Or what about, have you ever had something like a sprained ankle and it just seems like it's too loose, something along those lines? Well, then prolotherapy is the thing that you should be thinking about. So, for you, Dr. Donish, I've got a couple questions. So, why is it that people can get stuck in rehab, and how do you think prolotherapy plays a role in help getting them over that hump?
Well, we've talked about how orthopedic injuries take place, namely that as we age, the structures in our bodies start to break down. Like we see it on our face with wrinkles. The same thing is happening inside our bodies. We develop wrinkles on the inside in the ligaments and joints. So joints, rather than moving like this the way they were designed to, they start slipping and sliding and rolling all over the place. Well, typically with rehab, with physical therapy, what they're doing is they're utilizing the muscles in your body to act as second support structures to those ligaments. So when the muscles tighten down or they contract in a way that they weren't normally doing, you're able to recreate some of that stability and get that joint moving again. But there are times where either the muscles are too weak or frankly the problem is just too lax, where with exercise alone you're not able to get the leverage and the momentum you need to really build that joint motion back into normal function. And so people reach this point and they stagnate. They get some improvement, but then they start to see regression and things going backwards. And that can be really frustrating because they've put in so much work, they've put in all the effort to try to get better, but it's just not reaching that critical launch velocity to really get people better. That's where we really come in and we can do a lot for patients, because at that stage, we want to jump in there. In fact, before you get to that stage, we want to jump in there and help understand the mechanics of that joint. Is this, sometimes it's neurological inhibition, meaning that when you hurt, your body changes the way you move and it limits certain motions. Is it that the joint is too loose and your brain really can't fire in the right sequences to get everything moving the way it was supposed to, or to get that mobility back? Or is it just that you reached a roadblock as far as how much strength and stamina you can build in getting that joint to be stable again? Whatever that is, it's a really important time for us to jump in and figure that out.
Okay, that's interesting, because most of the time, especially earlier on in my own training, I would have thought that if rehabilitation plateaus, that's the time when only option is surgery. But it sounds like something like regenerative medicine and especially prolotherapy might be an option.
Absolutely. So everything that we do in regenerative medicine is to recreate stability to that joint and essentially, if not make surgery obsolete, then at least push it out so that it's really a late stage intervention, as opposed to the way it's used right now, which is everything jumps forward to a surgical outcome. Surgery has its role, but there's just so much low-hanging fruit of things that we can do for people without needing to go into surgery to resolve those issues. And prolotherapy is really kind of one of the more foundational elements of that. It's a very old science. I mean, it dates back to the 1930s, but it really never gained that traction because there are newer and sexier treatments. Like, there was a time where any surgery that took place in the body, it would have to be an open incision. They'd have to go look inside. And then arthroscopy came in, where you're able to look inside of joints without opening things up. You could do it through a camera. And those things are really cool and really sophisticated. And so there's an overreach on what conditions those things address. Well, prolotherapy, it goes back, I mean, it's been used in military hospitals. The Surgeon General, C. Edward Koop, wrote an article advocating for its utilization, but it just never really picked up that much momentum. And for a variety of reasons, many of which conspiratory reasons we won't get into. But the foundation of what prolotherapy is understanding the mechanics of that joint and figuring out what are the structures that maintain the stability of that joint, figuring out what has lost its integrity and causing that domino effect, and then figuring out what can we do to stabilize that structure, or stabilize that ligament. Traditionally, steroids are used in injections. The problem with steroids is they will lower inflammation, but inflammation isn't a bad thing. Inflammation is just the mechanism by which your body repairs. So lowering the inflammation on a regular basis means that you're hindering the body's ability to repair itself. And in a joint that has lost its integrity, the main question is why is that not able to repair? Because it did when you were a kid. Now all of a sudden it's not doing that, and we have to figure out why. What prolotherapy does is it uses inflammation, because that's the route with which your body repairs things, and it reinstigates that inflammation in the areas that need it the most. So step one, figure out what are the mechanics, what are the failures in that mechanics. Step two is figure out why it is the body's not able to repair itself. And then step three is use prolotherapy or some agent to stimulate inflammation or repair responses in the specific structures that really need it the most.
So I'm still trying to wrap my head around it. I've been told my whole life inflammation is bad. So inflammation's good?
So I'm going to answer that, but I'm going to come at it from a different angle. We think pain and damage are the same thing. Like when something hurts, we are aware that there's damage. But not every pain is an indication of damage, and not every damage has pain. The link in between these two is inflammation, because inflammation signals the body that there is damage, and it sensitizes nerves to generate an awareness that something is broken down. Now, that means that inflammation has good things and bad things to it. Bad is that it hurts. So if you suppress inflammation, you're going to reduce the pain. But it doesn't mean you're going to reduce the damage either. So it's understanding in what situation inflammation has value and what situations it does. And we can kind of navigate that narrow channel of using inflammation for the value adds, for the benefits, without having all of the pain and irritation that comes with it. Typically, doctors have prescribed anti-inflammatories, or you're told to take an anti-inflammatory over the counter. But again, that's like a whitewash of all inflammation. And when we're using prolotherapy, what we're trying to do is be very selective about where we create inflammation so that we're generating a repair response in that area, but also minimizing the areas that are going to be irritated and hurting.
Okay. I think I'm getting a better idea that inflammation's basically just your body's way of trying to repair stuff, and that's how your body's bringing food to these hungry tissues, trying to eat up and repair themselves again.
Exactly. Yeah, there's just so many different aspects to inflammation. I mean, there's the nerves that become sensitized and generate awareness for pain. There's the increase in blood vessels or the dilation of blood vessels in that area so that you have more nutrients coming into that area, more cells going into that area, more ability for the stem cells that are attached to the blood vessels or the stem cells that are out in the periphery to catch a ride within the blood vessels and make it down into the area of damage. It causes your blood vessels to become leaky so that cells can come in and out, and they're able to take up debris, put it in the bloodstream so it can be filtered out elsewhere. It allows for the cells that are running through the bloodstream to exit along with some of the fluid, and that's where the swelling or what's called edema comes from. That's your body's response to create more highways or more avenues for cells to navigate through the tissue and get to the right spots that need the damage repair. A lot of the things that we were once told, like rest, ice, compression, elevation, those are in some ways outdated. Even the doctors who advocated that, like Dr. Milken, was one of the first people that coined the term RICE, or rest, ice, compression, elevation. And he's come out later in life and said that this was a mistake because we need the inflammatory process, we need the edema, we need the swelling, we need the pain in order to generate the repair responses our body needs to fix the damage that's being identified.
Mm-hmm. So I think I've got an idea of how the effect of inflammation kicks in and helps out the body. I'm kind of curious about how prolotherapy does exactly what it's supposed to do other than bring inflammation in.
It's a great question and a topic of research, the theories behind it. So prolotherapy, there are a number of different agents that are used in prolotherapy, one of which is, the most common which is just sugar water, dextrose. And it seems kind of like, that's like, we talk about placebo injections as being sugar pills. Well, it's not a do-nothing treatment because we're putting it in at a concentration that is far, far higher than what the body sees in normal settings. So when there's it's called an osmotic gradient, where there's a higher concentration of solvents in one side than there are on the other side, and because of that differential, your body tries to create equilibrium, and it pumps fluid into the area that has higher concentration. Well, if you have a normal healthy tendon or ligament, it's able to adjust to that. It's able to compensate. But if you've got fibers that are interrupted or cells that are interrupted with fibrous tissue, that they're mangled and rather than being in nice linear spots, they're kind of curled in on each other. If you get a high concentration in that area, that cell is going to see a higher amount of that salt solution, and it's not going to be able to compete with that. So it ruptures and it breaks down. We want that. We want the weak fibers that are not adding value, that are not doing you any good, to break down and make room for the fibers that do add value and do create tissue strength and integrity.
Interesting. Is that how it kind of has a tighter feel to the ligaments after a prolotherapy injection?
Well, that's just simply because we're dilating tissue. We're infusing fluid into that area, so it's going to feel tighter. It's going to feel more stable. A lot of patients, when they've had a wobbly knee for a long period of time, or their back feels just unstable. If they get into a certain position, it feels like, ooh, that if I keep going in that way, I'm going to hurt something. After we do a prolotherapy, immediately they feel much more stable, much more solid. It can be a little achy afterwards, but that stability is what we're after. And even that immediate stabilizing effect is giving us that feedback that, yes, we're on the right track, we're doing the right things to create greater stability to these structures. Because a healthy tendon or ligament is not going to pressurize. That fluid dissipates so quickly it leaves that structure. But a damaged one where you've got all these mangled up fibers, that one's just going to hold on to that fluid, and you're going to blow it up, and it feels like, man, this is a lot stiffer than it was before.
So if somebody has this feeling, the injection's given to them, it feels stiffer, they feel good, am I hearing that it's only a temporary effect?
Yeah, initially you're going to feel some stability, but it's also going to ache. As that fluid dissipates, the weak fibers are going to break down. So typically, a Prolo injection, or most regenerative injections for that matter, they can hurt more for a couple of days because this is like having surgery without surgery. You're going to have a little bit more achiness in the first 72 hours, and then as that fluid dissipates and it is processed by the body, as those weaker fibers break down and inflammation allows for the body to recognize injury, it's going to mobilize very quickly. Even the weakest body, elderly individuals, they will mobilize repair responses pretty quickly and get the body in a state of repair. Within 72 hours, typically, people feel like things are back to normal. It's no better, no worse than what it was before the injection. And that's where the magic begins, because now your body's starting to layer down new tissue and healthy tissue, and over the next 3 to 4 weeks, it's gonna start rebuilding and strengthening that area. I kind of say, you and I have this problem where we don't really get bad haircuts anymore because we don't have a whole lot of hair. But it's like getting a bad haircut. It takes about 3-4 weeks for it to grow back out to a point where it looks like, you don't look horrible.
Definitely don't have that problem anymore. Well, with the prolotherapy, I think we've mentioned how a loose ligament can be a targeted area. So everybody thinks, oh, well, I got a loose ankle because I've sprained it all the time when I was younger, and it's still loose today. Is that the main spot where you target prolotherapy?
Not necessarily, because the loose structures in your body are part of a larger mechanical chain. So how your ankle moves is going to influence how your hip moves, how your back moves, how even your shoulders move. One little trick I have to explain this to people is take one hand and put it on your waist, take the other hand and start waving it. Go ahead. So what do you feel with your left hand?
Well, I probably need to do some more sit-ups, and I also feel the muscles kicking in a little bit better.
Right. So the muscles in this hand, the muscles that you're gripping on, as you're waving this hand, you're going to feel those muscles tighten and loosen, because this whole body is one mechanical chain, and if I'm moving something over here, then there has to be something on this side stabilizing it. So when you have a loose ankle, or if you've had chronic sprains, that problem's not just at your ankle. That's likely going to have affected the muscles in your leg and your knee. We see a lot of patients who come in and they've got knee arthritis, and it's, yes, we have to address something in the knee, but there's also something going on in the ankle or hip that's affecting that, and we really need to address the whole thing. The beauty of prolotherapy, in my view, is really that holistic mindset. It's not looking at, okay, we're just going to eliminate the pain in this joint. It's looking at the whole body and understanding how the body's moving, how the specific tendons and ligaments and muscles that are allowing for movement at that joint, how they're all working together in order to create motion. If we ignore the bigger picture, then we end up in this rat race where people get steroid injection, they get better for a while, and then they come back and they're worse, and it just never ends because these things accumulate over time. It's not like you're getting healthier as we age. It's that things are starting to break down, and the longer we wait to address these things, the harder and more complex it becomes, because it's a set of dominoes that's now dropping not in one line anymore. It's dropping in multiple different lanes, and figuring out how all those different pieces will fit together becomes more and more complex the more dominoes that fall.
I understand. So it sounds really complex, though. How is it that this is done at Wellward?
We have a very integrated approach. We start with a methodology. The acronym is HEAL, which is hearing what your body's trying to convey with pain, envisioning what life is meant to be like, alleviating symptoms, and then leveraging what your body does normally to repair in order to produce greater degree of repair. The first phase, that hearing what your body is trying to convey with pain, is really critical, because that's the stage we call pain mapping, where we're trying to actually identify the specific bits and pieces of your body that are not working well together and not just causing pain, but causing mechanical dysfunction.
I hear we did a show on that not too long ago.
We did. Actually, if you go back a few episodes, you'll see the pain mapping show.
There you go.
Nice plug.
You were saying.
So in pain mapping, we're using your symptoms of pain to better localize or hone in on what are the mechanics, what are the damage points in your body that are not working well together and causing this. It's not as easy as just saying, oh, well, it's just knee arthritis, so I've got some pain and it's going to be there. It's a matter of understanding, okay, so there's knee arthritis, but what specifically in your knee is causing pain? And tracing that, finding those little needles in the haystack is really where the gem of regenerative therapy comes in, because once we understand if it's this one mechanical part that's broken, well, we don't have to replace the whole engine. We can just replace this part, and the engine will start working again. And that's the qualm I have with healthcare right now, is it doesn't really go into that depth. It doesn't really go into understanding, okay, so you've got bone-on-bone knee arthritis, but really what's causing pain? Because so often we've seen these over and over where the patient comes in and they've got this horrible looking x-ray and they have zero pain in their knee. And we're like, what's the difference between this guy and the next guy who's got terrible, terrible pain, but very minimal changes on his imaging? Has to do with figuring out what is that specific part that's not functioning correctly that is causing pain. And rather than replacing the whole joint or ignoring the problem until it becomes a point of no return and you have to have surgery, figuring it out early on and fixing those small bits and pieces.
Oh, okay.
That's what prolotherapy does.
Very, very cool. I like hearing that. Well, we actually have a question.
Oh, great.
A gal named Amanda wants to know if it would help out her ankle rehab after she had a fracture and that was repaired.
Yes, absolutely. So if you've had any kind of trauma or injury or fracture, the question then becomes is what else has been affected? Because the bone might mend. They can, cast it. You can do surgery to fuse that bone or fix that bone. But what's not really attended well to is the soft tissue damage that results as a result of that comes about as a result of that fracture. So if there's chronic pain after any kind of injury, whether it's traumatic, surgical, if you just have a small slip and sprain, these things can accumulate. And that's where we can understand why is it the pain's not going away, because clearly there's some mechanical defect there, and figure out what do we need to do to fix it. So prolotherapy can definitely be utilized in that situation.
Well, it's good that you're mentioning that. I still think about back in my earlier years trying to help rehabilitate people who've had ankle fractures. They'd have hardware put in to stabilize a bone, and they'd just have the hardest time with just residual pain around the ankle. Their ankle would feel wobbly, and they just wouldn't be as balanced on that side. And I wouldn't have anything that I could offer them because the exercises, they were working hard, and the bone looked like it was healed. There was nothing for me. But I'm glad this is an option now.
Yeah, absolutely. And there's another caveat to that, which is that it's not just about the mechanics, it's also about the wiring. So a lot of times in those situations, the structures might heal correctly, but the nerves have not normalized. And those are also, that's an aside from prolotherapy, but there is something we call neuroprolo, where if a nerve becomes entrapped or irritated, we can actually visualize that, and we'll have to do an episode on this where we can visualize the nerves in the body and show situations in which it gets entrapped. Like something that's very common that people know about is carpal tunnel, and that's when a nerve gets trapped inside a canal within the wrist and causes numbness in your hand. Well, this can also happen in other scenarios, particularly after surgery or trauma, where the body has created some scar tissue and those nerves that are running through there get squished up and irritated, causing like a firing signal on a regular basis, or causing mechanical changes, because the nerves are what give your body the understanding of where your limbs are in space, so they control the muscle movements. If a nerve is entrapped, then releasing that scar tissue becomes a priority. And we can do that with basic injections to get some great gains, we get a whole lot more when we use neuroprolo. I've done a show about that in the past with one of our patients. He had a ulnar transposition, meaning that the nerve that runs in the elbow and goes into this part of the hand. Sometimes
the funny bone?
Yeah, your funny bone. So if you
Oh.
pound your elbow on something and you get that jolting pain, that's the ulnar nerve. He had a surgery where they moved that to another location, and afterwards the scarring from that left him with just the residual pain. And we've done dozens of injections with some improvement, but then we did a neuroprolo injection and he got remarkable improvement with that. So there's a lot of utility to that, and we can talk about that in a future episode because nerves are really important.
Wow. So what are the areas throughout the body that you use this on if it's not just for neuroprolo and ankles?
Literally any structure in the body that has a mobile part, like elbows, wrists, shoulders, hips, knees, anywhere in your spine. You've got 52 different joints in your spine. Any one of those can become problematic, and prolotherapy can be very helpful in figuring out both what's wrong and how to stabilize it.
So this sounds like it's a good place for people with chronic pain to be looking for who've been stuck for a while, and especially it's a nice holistic approach for people who don't want to have surgery.
Absolutely.
I like it.
Yeah.
Prolotherapy sounds cool.
And the earlier the better, because there is a point in time where we're not going to get gains out of prolotherapy, and at that point I do recommend surgery to some patients. But really, there's so many opportunities ahead of that point that we can jump in. If you just got some minor ache and pain in your joint, like you're still jogging, you're still moving around, but you have something that's just irritated, that's a great time to come in and be seen to figure out what needs to be done to get this back to a normal functioning joint, as opposed to just dealing with this minor ache and pain that you take some anti-inflammatories for every now and then.
Mm-hmm. Someone just commented that they are thinking that of the reduced morbidity from avoiding an open surgery like decompression is a great concept.
Yeah, absolutely. Especially if you're talking about spinal decompression. We'll do another show on the spine at some point down the road. But there's just so many advancements with spine that I think 95% of surgeries are going to become old-fashioned and unnecessary. It's just a matter of time. We are already seeing some major strides forward, some things that historically have been deemed as surgical cases, in a combination of prolotherapy with some of the other modalities like minimally invasive lumbar decompression surgery.
Which there was a show on that not too long ago.
We need to make a list. But these things we can really make a big strides without the need for surgery. Surgery is fantastic when it's needed, but there are just so many situations in which it's not. There are alternatives.
Oh, I like hearing that there's these options out here. That's
Absolutely.
good. Well, I believe that's pretty much all the time that we have for today.
Well, I appreciate, James, you do great work about bringing these great questions. So I appreciate everything that you're doing, and I appreciate you, the audience, for paying attention to the messages that we're trying to put out there.
And if you have any topics that you think you would like to hear more about, we can do some research and then present it for you. Just let us know. Comment on here or send a message to us at wellward.com.
Wellwardmed.com.
Oh my gosh. How do I keep messing this up? Thank you.
Thank you for watching the 50 Shades of Pain show. Each patient is different, and there are numerous factors that contribute to your pain. Likewise, we recognize each patient as an individual, creating treatment plans designed specifically for your health. Our Wellward team looks forward to partnering with you. I'm Dr. Donish.
And I'm Dr. Escaloni.
And we encourage you to start your healing journey at wellwardmed.com.
Thank you. Bye.